Hi, welcome back to Functional Friday. We are talking today about a new test that we have for early cancer screening. What do you think about it?
This is the Gallery test, and I've been thinking a lot about it because I had it sent off on myself earlier this week. It's a blood test, and it looks for markers that are shed by actual cancer cells that would be floating around in the bloodstream. So unlike genetic testing that we do on people sometimes to predict like if they're at risk for developing a cancer, this test actually is going to tell me if there are cancer cells floating around in my body that are too few to be detected otherwise. An example would be like pancreatic cancer. Usually if that it presents after the cells have formed a tumor and grown big enough to cause pain or other symptoms. And by then it's pretty far along in the disease process. So this could tell me if there were, just a few pancreatic cancer cells floating around. It tests for more than 50 different types of cancer.
Nice.
I'm actually looking forward
You nervous?
and that's what I've been thinking a lot about. I don't feel nervous about it. I feel like it will give me information that I can act on.
Empowered.
It's one thing to get told that you have cancer and you can treat it. In this kind of test, we might find that there are cancer cells, but it's too early to actually identify, like in the pancreas or other organ in the body. Somebody used the term pre-positive state. So the fact is there are cancer cells there, but they're not enough to start treatment. And that might be a particularly nerve-wracking time for some people to receive that information but not be able to start treatment. It's a whole new world of medicine when we get to that point.
Right, truly preventative. And
Yes.
what happens if somebody shows up positive in one of the areas on the test?
We'll continue to use pancreatic cancer as an example. We would then do imaging of the pancreas. We'd probably refer to an oncologist to get the most up-to-date recommendations for what the earliest intervention for that cancer could be. And then we might have a lot of watchful waiting where every few months we screen that organ via ultrasound or CAT scan or whatever modality would be the best to detect it the earliest. The Gallery test is recommended to be repeated if it's positive. They'll do a second test to make sure it's not a false positive. And if it is continuing to be positive, then we would just keep following the patient very closely and following myself very closely.
Who do you recommend for what kind of patient would be best suited to have a test like this?
Well, I hate to bring up insurance, but this test is not covered by insurance and it costs about $900. It is a test that once you do it, and if it's negative, the recommendation is to repeat it once a year. So it's a bit of an investment in cancer prevention. So someone who has that willingness and ability to run this test on themselves, I would recommend it over the age of 50, especially if you have a strong family history of cancers or personal risk factors like smoking or just poor diet. Diabetes, people who have underlying inflammatory conditions in the body, people who have been on immunosuppressant medications, maybe with autoimmune diseases, I think are more likely to develop cancer. So if this was a test that they were interested in, I would recommend it. But I also would ask that anyone who's interested in doing it do some soul searching before getting involved with this kind of cancer detection, because if having the information early is going to create a lot of anxiety, and instead of empowering the person to live their best life and to get as healthy as they can and to do their screenings, then we wouldn't recommend getting it done.
I feel like because of the specificity with this one that would be preferred from an anxiety perspective and probably other perspectives versus the full body MRIs that have been popular, right?
Right. Full body MRIs. If we do an MRI all of our bodies from head to toe, you're going to find a small stroke in the brain or
Find stuff all the
a
time.
cyst or a mass in the liver. You're going to find things that are just called incidental-omas, and then you have to work up each individual one. So I think that this is a better way to do that.
Yes.
Yeah.
Do we know when it might ever be covered by insurance or?
The rep for the company said in the next 2 years.
That's great.
Yeah.
Okay. Okay.
Yeah.
I can't wait to see your test results. So far, I think everyone we've gotten back has been negative.
Yes,
Right.
yeah, we've released some people and had good results so
That's
far.
I will affirm that yours will be good as well.
Thank you. I feel strangely peaceful and calm about it. I just feel like it's going to be information either way.
Yeah, that's right.
Yeah, good.
Thank you.
All right, thank you.